If we're focusing on the 5 drivers, personal, community, physical, nutritional, spiritual, a lot of mental health already solves itself. If you have the right purpose, community, you're sleeping well, you're eating well, you're exercise, right? All of these things. So I want to just encourage our listeners to not jump to the answer for the individual issue that someone's facing before we're really thinking about these 5 drivers of health and wellness. And I believe if you're going after that first, then that's the Pareto. Then 80% of the downstream issues solve themselves.
New choices, new players, new models of care. You know consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. This is episode 375. We're getting closer to 400 people. I'm Jared Johnson, and here's what's going to go down today. We have the Flava of the week about older Americans being dissatisfied with their care. What particular aspects of care do seniors want to be improved, and how do we use those insights when designing and executing senior-focused care? I'll talk about that. Then we welcome back Dr. Gordon Chen to share the story behind ThriveWell, the 5 drivers of health and wellness, and dozens of keys to increasing longevity and preventing hospitalization. Let's get right to the awesomeness. Are you ready? Let's go.
Flava of the week.
Care for aging in America needs urgent rethinking. That's according to a survey of older adults that reveals wide-ranging dissatisfaction with healthcare and related services that don't reflect and respond to how people want to live as they age. A press release stated that AgeWave and the John A. Hartford Foundation released findings of a national survey called Meeting the Growing Demand for Age-Friendly Care. It underscores that America's 65-plus population is skyrocketing as opportunities go unmet to provide better care and tailored services to enhance a person's health span versus a lifespan. Older adults who live in rural areas and or women, people of color, and those who are economically disadvantaged or have limited functional health are especially dissatisfied. U.S. Census Bureau data shows that the nationwide population over the age of 65 is expected to rise dramatically from 56 million in 2020 to 82 million by 2040. The massive increase in the number of older adults is compelling governments and the private sector to rethink approaches to healthcare, social services, housing, and more to help older adults live well as they age. 4 in 5 older adults say the U.S. healthcare system is not prepared for the growing and changing needs of America's aging population. And just 1 in 10 gives the healthcare system an A grade. Digging through the data, I found one key insight particularly interesting. It said instead of the status quo, older adults say they want solutions that will maximize their golden years, like interventions that make care more affordable, innovations to reduce or prevent cognitive decline, and healthcare providers who understand what matters most to them when assessing care options. Those are important insights that hopefully we'll bring back to our organizations and prioritize in our strategic planning, experience design, and marketing strategy. My reason for bringing this up at all is to remind us that we do need consumer-centered care. The current system doesn't meet the needs and expectations of so many people. This report highlights the needs of seniors, but it applies to practically every segment of society. So in case we need a reminder, we have a lot of work to do to provide healthcare in ways that lead to greater satisfaction when we need it the most. And as I frequently say, we'll get there faster together. Let's use these insights when designing and executing senior-focused care so that we can be part of the solution, not the problem. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week.
The flow.
All right, let's get into the flow. Those of you who have been longtime listeners know there's only a certain number of people who we invite back for a third time. Dr. Gordon Chen is absolutely one of those, and Dr. Chen is back with us today, number 3. Welcome back.
I'm excited to be back for number 3. Yeah, this is like we're getting in a rhythm now, right? So Excited to be here and sharing what we're doing at ThriveWell.
It's kind of like an annual checkup, I would say.
Yeah, that's right. Yeah. Am I the PCP or are you the PCP? But
I'm definitely leaning on your insights here for sure. So we'll go with that. We're really glad to have you back. And we have a lot to talk about, man. There's a lot that's happened since the last time we did have you on. A new role, a new organization, but all based on, I think we'll get into this, some of the insights from your career trajectory up until now. So really excited to dive into all of that. But let's give those who are newer listeners who haven't had the fortune of hearing the first couple of times that we've had you on, what do you like our listeners to know about you?
So I've been on this just amazing journey in healthcare leadership, and healthcare transformation. And as it continues to evolve, my urging to any of the listeners in healthcare, whether or not you're a clinician or in leadership or whatnot, is to continue to charge ahead, knowing that there's a better way to deliver healthcare for our patients, for our communities, for each other. And so let's continue to have that right growth mindset that we can make the changes needed come to reality. A little bit of my background, many of you may have heard of Chen. Chen is our family's company. Learned a lot over the last 20 years, innovating, growing, scaling medical centers across the country that are purely focused on a values-based care and an outcomes-based care platform. And we've done that very successfully at Chen. I had the wonderful opportunity about almost a year and a half ago now, to step out of our operating roles at Chen and empower some of our other clinical leaders to step in as chief medical officer and different clinical leadership roles. And Jessica and I at that point in time, still obviously involved in Chen, but not now in the day-to-day operating. We had an opportunity to just reflect and quite honestly, pray and just ask God, hey, what do you have for us in our future? How are you leading us, and where can we make the biggest impact? And through that process of discovery and just reflection, we created ThriveWell. The point of ThriveWell is to take a lot of the learnings that we've had over the last 20 years in Chen, improving outcomes, scaling it, helping people to live 5 to 7 years longer, and decreasing hospitalizations 30 to 50%, which obviously has an impact on outcomes. Is how do we apply that to a broader population, right? What about folks like middle-aged, that the earlier that we get started, the bigger of an impact that we can have. And so basically, we're trying to figure out how to create communities that can commonly live to over 100. And so what does that mean to an individual? How do we maximize health span, right? Which is not lifespan, which is the healthy years, the functional years, the purposeful years. How do we maximize that? And we came up with ThriveWell as our platform, but launching multiple disruptive companies under that platform that ultimately can bring 20,000 more Thrive years to each community that we serve. And how we describe a Thrive year is an additional year of a health span achieved through optimizing health, wellness, and purpose. And so just casting that vision and saying, hey, how do we improve our community's Thrive years by 20,000? That's the journey that we're on. And so we're launching this company called Blue by ThriveWell, BLU by ThriveWell. So Blue stands for Bringing Longevity to You. And basically, it's a physical location where we can help take accountability for people's health span, optimizing it, but create also this whole concept of a longevity community. And it's a place where the 5 drivers of health and wellness can be optimized. And that's personal, community, physical, nutritional, and spiritual. So anyways, Jared, I said a lot in the background. Want to give you an opportunity to help kind of shape the discussion and whatnot. And I'm sure you've got great questions.
No, I was going to ask about the drivers, those 5 drivers. Can we get into those a little bit and talk about how you've seen that those are those main things that impact longevity or drive it?
Absolutely. Yeah. So when you're growing and scaling a company that has to improve outcomes, right? Over the last 20 years, you learn a lot and you come up with themes. And the key learning is it's not all about the medical care, right? It's not all about the science. There's a broader approach, like things like purpose, community, whatnot. And we'll get into each of the drivers, right? But we studied that. We also have been doing medical mission work in Nicaragua for the last 3 decades. And we're kind of scaling a pop health approach there, improving outcomes in remote communities there. And so we invited some of those leaders to join us in thinking of how do we scale this transformative care platform, right? And then we also studied things like these longevity communities, these blue zone communities, like what are consistent themes? And it really brought us back to these 5 drivers: personal, community, physical, nutritional, and spiritual. And if you think about each of these components, like everyone can have an opportunity to improve and gain ground in each of these drivers. And if you're doing that well, there's a synergy between them. And then consistently, if you're growing in these 5 drivers, then you're going to optimize your longevity, your health span in particular. Okay. So what we did at ThriveWell is we said, well, we can't boil the ocean for every one of these things. Let's just nail it down to the key components of each of these drivers. And that's how it can be more applicable and more real. And so each of these, let's talk about the first one, personal, right? The personal driver, you can go in a million different directions, but we're saying, hey, just focus on 3 things. What is your purpose? What are your priorities? And what is your plan? Purpose, priorities, and plan to live out that purpose, right? And if we can do those things, many of the listeners may have had life coaching, executive coaching, whatnot. That's the cornerstone to just understanding how to move from drifting to being very intentional about what you want out of life, right? Purpose, priorities, and plan. Simple framework. That's the personal component. The community component, which a lot of healthcare misses, right? Because we all always think about the individual doctor-patient relationship, but we forget that there's a whole community involved. And so the community is everyone contributing to the community, the feeling of the community, but it really has to have 3 key attributes. To build a longevity community, it has to be engaging, encouraging, and empowering. And that's the responsibility of everyone involved in creating that community, whether or not you're a clinician or a patient, or whether or not you're part of the just friends or family. If you want to create a longevity community, it has to have those 3 attributes, different than a disempowering type of model, which oftentimes you see in healthcare, right? Or kind of command and control style, right? Or, as you get older, maybe you lose function and then maybe you can continue to enable that loss of function. No. We want to continue to empower, especially, as folks age, right? So that's the community component. The physical component, obviously super important, right? You can go very deep into the medical approach, but just before we even get to the medical approach, there are 3 simple things that we just need to nail: sleep, steps, and strength. And those 3 things in the physical component, if we hit that well, then a lot of the other downstream effects solve themselves before, problems get solved before they even manifest if you're winning in sleep, steps, and strength. And basically that's, you got to recover, you got to renew, you got to really nail the sleep component. There's so many different advances from a natural standpoint and just from a sleep hygiene standpoint to win. We got to move with the steps and we got to track it. That's why these step counters are fantastic. We got to track our movement and hold ourselves accountable to continue to move. And then, of course, the strengthening. We're finding out more and more if you're not getting stronger, you're getting weaker. And particularly for women, we need to work on strength training, strength building. That correlates strongly with longevity. Okay. Nutritional component, I'll kind of speed up through this. This is, so many diets out there, but if you want a longevity approach, there are 3 critical components to that. And we call it the MRS diet after my missus, right? And think of it as the missus diet or the MRS. Okay. That's an easy way to remember what we should be putting in our mouth, right? Number 1, M, it's got to be mostly plant-based. I try to stay away from this concept of being completely 100% plant-based or vegan or whatnot. Mostly plant-based. It is dose dependent. If you can get from 60% to 70%, it's better. 70% to 80%, it's better, right? So we try to get to that closer to 90% plant-based range. And then R stands for real whole foods, not the artificial stuff, not right, real whole foods. You can see pronounced, not full of chemicals and preservatives, right? And then S is a behavioral component, which oftentimes the majority of different diet programs forget about, which is S, stop before you're full, right? We learned about that in Okinawa, Japan, right? The 80% rule. And this is like before you are eating, kind of having some accountability with whoever you're eating with to say, hey, I'm going to stop before I'm full. I'm doing the MRS diet. S stands for stopping before you're full, right? If you wait till you're full, you're probably overeating, all right? And lastly, the spiritual component, obviously this is very personal to each individual. For me, it's like very important. It's a big driver of my purpose and my life, like my relationship with God. But however people are focusing on their spiritual health, we really need to win in meditation, mindfulness, and motivation. Those three things. And the motivation brings us back to purpose. So that's the 5 drivers of health and wellness.
There's a lot in there, isn't there? I love this thought. And I'm trying to think, on the practical side now of what you've built with ThriveWell. Can you walk me through kind of how somebody participates and how they put some of those drivers to use with what you guys are creating?
Absolutely. So the platform and the foundation of producing a longevity community would be thinking about winning in each of these 5 areas, right? And the reason why that's important, and let me use like mental health as an example. Like someone asked me a question, well, what about the mental health issue and whatnot? And if we're focusing on the 5 drivers, personal, community, physical, nutritional, spiritual, a lot of mental health already solves itself. If you have the right purpose, community, you're sleeping well, you're eating well, you're exercise, right? All of these things. So I want to just encourage our listeners to not jump to the answer for the individual issue that someone's facing before we're really thinking about these 5 drivers of health and wellness. And I believe if you're going after that first, then that's the Pareto. Then 80% of the downstream issues solve themselves, right? So how does this work for ThriveWell? So let's use Blue by ThriveWell. So we're creating this beautiful 20,000 square foot facility in East Fort Lauderdale. It's going to have the latest and greatest in personalized fitness, nutrition, recovery, longevity medicine. And how we designed it was based upon the 5 drivers. So for example, right, we know strength is important. So we're building in the best personal training platform and accountability to help hold each of our members to their goals, right? Which typically will be, hey, I want to increase my health span by 10 to 15 years. And they set up a plan towards that. So our personal trainers will work with them with state-of-the-art equipment and also with recovery, cold plunge, sauna, infrared sauna. And then we'll also be able to measure their progress with VO2 max testing, body composition testing. So we know very specifically, is our training program working to help people to improve in the key measures that impact their health span? For example, we all know that healthcare shouldn't be using BMI. It's outdated. It doesn't reflect like what is important to many patients. I've been told that my BMI is overweight or obese for my whole life, and I've been in pretty good shape, right? And, bodybuilders also, or people that, work on strength training, you almost get negative reinforcement with BMI. But imagine if you had accurate body composition testing where you're checking your, with a DEXA scan, you're checking your soft tissue muscle mass and your body fat, your visceral body fat, and that's the most accurate approach. So that's the best way to gauge whether or not your training is effective or not. Like many people, they step on a scale and do impedance testing, and the body fat measurements can be off by like 5%, depending upon how much you're hydrating or not, right? And it sometimes can be discouraging if you don't have that accurate reinforcement of what is happening with your body. VO2 max, let's talk about that. What is VO2 max for listeners? This is a healthcare audience, but just it's important to know this, with greater level of specificity, right? Basically, it's your maximal or peak oxygen exchange in your body, and you measure that by going to maximal exertion, either a treadmill or a bicycle, and measuring the amount of oxygen consumption. And so there are all these estimates for VO2, which are close, but it's always good to know with a gold standard, what is your VO2 max? Because every point that you can improve VO2 max will improve your survival by 5%. This is important. So if you can improve your VO2 max by 5 points, that's a 25% improvement in survival. And we know that with the right training program, the right environment, even people in their 60s, 70s, 80s can improve their VO2 max. So why aren't we doing that? We aren't, because healthcare as it exists today is a pass-fail system. You're either fine and don't worry about it and you're in the normal category, or you're not fine and you're sick and we've got to do everything we can to get you back to normal. But we aren't thinking about optimal, right? We're not trying to squeeze out as many healthy years as possible. We're just like, hey, if you're not failing, we're going to ignore it, right? That's healthcare. And quite frankly, I mean, payers are struggling with managing all of the skyrocketing costs of healthcare, which most of them come from sickness, disease, hospitalizations. So we gotta break the cycle in this country, right? So back to your question, Jared, we're intentionally creating a facility that can facilitate these 5 drivers of health and wellness. For example, the community component. We added 3 indoor pickleball courts in East Fort Lauderdale because we want to create that interconnectedness, that community. And as soon as you have a pickleball court, you almost create that community instantly, right? And so think about how most of healthcare works, even like executive health or individual one-on-one type of, like healthcare delivery. It's very, first of all, impersonal, and you're not thinking about the peer-to-peer influence. So we want to break that. So we'll basically have longevity medical assessments and executive physicals that are done that will start with purpose coaching, nutritional visits, an executive physical, fitness assessment, and then we'll train people how to actually achieve their greatest health span goals.
There are some keys I think that you've mentioned to me in the past that maybe I can do this almost a little rapid fire. Like if I just mention some of the things that you've mentioned to me before, let's see how these fit into that plan and just to longevity-driven health in general. One of the things you mentioned to me in the past was coaching. Tell me how that impacts things.
Oh, coaching is critical. So first of all, what we learned in Chen Med, in order to improve patient outcomes, clinicians need to adopt a coaching mindset. It's coaching for health, not consulting for sickness. Most clinicians are still consulting for sickness. We need to flip that mindset change to coach for health. That means we're partnering with them to achieve shared goals. And as a clinician, we take accountability for whether or not they can make the behavior changes to lead to that result. Think of the coach. The coach on a team takes accountability for the results of what happens to that team, correct? Not just the players. And so the typical healthcare mindset is, oh no, I gave my recommendations, I gave my referrals, my prescriptions, and it's on them. And if they don't do it, they're non-compliant. No. In our model, it's a coaching model, right? We partner together to achieve better outcomes. So that's one thing. So whether or not it's a personal training that's coaching and partnering, to share that accountability for those outcomes, or whether or not it's a clinician or a nutritionist, we're going to take that coaching for health mindset.
Another one you've mentioned, just maybe it was from previous time with Chen Med as well, but frequency of visits. You said that's had an enormous benefit too in the past. What's that insight there? Or how does that impact things?
Well, think about if you're trying to improve someone's outcomes, that's about behavior change. If you don't get people to change their behaviors, you're not going to get any improvement in outcomes, right? So when you think about behavior change, what are the things that drive behavior change? Well, you need reminders, you need accountability, you need frequency. For the parents out there, I like to use the example, you tell your teenager to take out the trash, and then you check back in a year whether or not they took the trash out, and you may have this like enormous pile of trash, right? No, you need to remind them, hey, did you take out the trash? You need to check this, see if they did it. And then, they take out the trash. Maybe we can progress the washing the dishes, right? You were training our kids to, do housework and whatnot. But that's more of a coaching mindset, reminding people and realizing that it doesn't matter if you say it, if they don't do it, if there's no behavior change, you've wasted your time, right? So healthcare needs to make that shift to, are they changing their behavior in a way that it drives better outcomes, or are we just speaking without, anything really landing? To do that, like in anything, you need to follow up. And the faster you follow up and the more frequent you follow up, the more likely you're going to see the changes occur.
Oh, well, I'll tell you, as a parent of teenagers, the taking out the trash analogy very much relates. So I love that. Next one, soft tissue muscle mass is another one you've mentioned to me. How does that relate to longevity?
There's just tremendous data coming out that, if you do a cross section of a thigh and you look like what's the muscle composition, what versus the fat, you can predict how long they're going to live, how functional they're going to be, right? And so when we look at body composition testing or DEXA, the amount of information that's useful for people that are focused on longevity is tremendous, right? So if we can calculate number of grams of muscle mass and then we can increase that, there's a direct correlation, particularly for women. So what we're seeing more and more is let's not only be thinking about bone health for women, like osteoporosis. You hear about this all like over and over again. Let's focus on not only bone health, but do they have enough muscle mass to support longevity? And in women, if we can increase not only their bone density, but their muscle mass, we're going to have the greatest impact on their outcomes. So this is important because a lot of people in general, maybe women a little bit more than men, I'm not sure, but like people in general need to learn how to effectively strengthen their muscles and not get injured, but train in a way that can build their muscles in a safe and effective way that will support their longevity. So that's the whole idea also with Blue, is to integrate it around heavy personal training and fitness integration with longevity medicine and our preventative medical services as well, like bringing that together. Now, with all the physicians, clinical leaders that I've talked to over the many years, like this would be a dream, right? Like how do you actually, have personal trainers, nutritionists, physicians all working hand in hand, aligning on a goal to help take accountability with members on optimizing their health span? And that's the dream.
And it makes a lot of sense too. I mean, like, especially describing it that way. And I love getting this granular on it. Just have a couple more for you. What you mentioned visceral body fat to me too. Can you just explain it briefly, like what that is and what the impact is?
Oh yeah, absolutely. So when you think about body fat, not all body fat is considered equal, right? So if you have very distributed body fat, it's different than if you have a high amount of body fat around your organs. So this is, you can't check this. Maybe you're on the thinner side, but maybe you have really high visceral, which means like inside your body, around your organs, like the fat around your organs, that is an even worse indicator of health. Meaning, if you're going to focus on where you're going to have the greatest impact as you're lowering your body fat, you want lower visceral body fat. You don't want your organs hanging out with a whole lot of fatty tissue. That's where, by doing a body composition testing, you can get smarter in your approach and your effectiveness. You could be skinny, but then have a lot of visceral body fat, and you're like, oh, that's still not good. Hey, there's still some opportunity to improve there. But you don't know unless you measure it. Unless you measure it, you'll never know.
Love it. And then the last one, which was maybe the most surprising to me, was grip strength. Tell me about that one.
There are a lot of different studies that look at older adults and who does well, who doesn't do well. And if you have greater grip strength, that is a reflection of greater life expectancy, right? If your grip strength starts to weaken, your muscles, particularly your theano muscles, atrophy, and the muscles in your hand atrophy, that's not good. That's a very poor indicator of outcomes. On the contrary, if you have very strong grip strength, guess what's going to happen? That means your fall risk is probably less. You're using your upper body more. You're not atrophying, that you're probably more active. And so basically, if we can measure and improve grip strength over time, this one's particularly more important for older adults. as you think about the followers, but really it's for everyone, right? So if you have strong upper body with strong grip strength and you can measure it, at least the studies to date have shown us that correlates very strongly with outcomes.
This wasn't just to have you on the program once years ago. I'm like, there's always something new. In this case, there was a lot new, and this is an area that I've had a personal interest in, and that's why I loved going into the drivers themselves, but some of these metrics that are relatively new to me, and I love the thought of how this all connects in. Gordon, anything we haven't mentioned yet that you want to make sure our listeners should know about what's going on with ThriveWell, or just any of the other insights that we've been talking about?
We're building out our Blue by ThriveWell facility right now. It should be ready in early 2025. Again, in East Fort Lauderdale, our dream is to be able to create 20,000 more Thrive years for not just the East Fort Lauderdale or South Florida community, but also for people that wanted to have a longevity medical assessment and executive physical, and they can come visit. We have these suites available and to go through all of the things different than a typical executive physical. We're going to go through purpose. We're going to teach people and coach people how to train effectively, how to recover effectively. And then, of course, we'll do all of the comprehensive and latest and greatest longevity medical assessments as well, which would include heart health, brain health, gut health, hormone health, and of course, genetics and epigenetics, like whatever we can have access to that actually works, we want to give our members. There's so much information out there that people oftentimes don't know, like, hey, like, what do I trust and what don't I trust? And so we're going to be very intentional and partnering with researchers at University of Miami and other institutions to make sure that we're taking a very data-driven approach and scientific approach and bringing that to anyone really interested in longevity. So listeners, Jared, listeners can just, visit Blue by ThriveWell. That's BLU by ThriveWell.com, or the parent company, ThriveWell.com. If they want to check us out, the Blue by ThriveWell will have a mailing list. If they want to enter their contact information, we can reach out when we're ready to open and showcase what we have. But this is going to be a state-of-the-art facility designed to create longevity communities.
Well, if you're up for it, we'd love to keep this a recurring appointment on the calendar and check in periodically. It's been seriously so insightful as always, and really appreciate the time. Dr. Chen, thanks for joining us today.
Oh, it's a pleasure to be here with you, Jared, and maybe in the future we'll have you visit our facility and take it for a test drive, check your VO2 and body composition, and let you kind of digest all of that data and get you as well, like, on whatever accelerated path to better health that you want to take.
Oh my goodness, we're going to take you up on that. Thanks for the offer. Love that. We'll definitely be in touch on that. And thanks again for joining us, man. I really appreciate it.
Wonderful. Great to be here with you, Jared. Thank you.